Radhika. Does it?
Hi, my name is Rita Aganobi. I'm a family nurse practitioner student from St. Joseph College of Maine. And is it okay for me to do your checkup today?
Yes, it is.
And can you please tell me what you're here for today?
I think I probably need a prescription for my seasonal allergies. I've been taking over-the-counter medicine, but it doesn't seem to be helping.
Okay. Any other, and I guess you're also here for your wellness check?
Yes,
All right, good. Do you have any pain, any problems other than that?
No, not really.
Okay, now I'm just going to do a general visual assessment. I'm going to inspect your skin from head to toe today, and then we'll see the doctor for final diagnosis. Is that okay? All right. Now, looking at your head looks symmetrical to your neck, and your skin looks even with no lesions. Temperature is nice and warm. And your hair, I'm going to check the hair for any infestation. The density of your hair, no lesions, no depression. Okay. And it's dark and even colored. Okay. Do you have any pain on your head?
No.
All right. Now I'm going to check your ears. And inspecting the ears, they look symmetrical. The pinea turgis is without any lesions or drainage. And look underneath the ear. Everything looks symmetrical and even on both sides. All right. I'm going to go ahead and inspect the internal cavity of your ears. Is that okay?
Mm-hmm.
Right. Okay. I'm going to pull up and back. I can see your tympanic membrane, and just with its little wax, but nothing abnormal noted. And let me go ahead and check the other one. I'm going to move up and back. Now the same thing. I can see your tympanic membrane and all the ear structures, and just a little wax, but nothing to be concerned about. Everything looks normal. All right. Now I'm going to go ahead and assess your eyes. Okay. And do you have any problems without your glasses?
No.
Okay, I'm going to inspect your eyebrow. Looks even. Then I'm going to ask you to open up wide so I can check your sclera and the peripheral fixtures of your eyes. Everything looks symmetrical and intact. Sclera is white. Okay, I'm going to have you to wear your glasses and you're going to read for me. I'm going to check your cranial nerve too. All right, go ahead and read number 8 line.
D-E-F-P-O-T-E-C.
And can you read it backwards, please?
T-C-P-D-O-F-E-L.
No, this is number 8.
Oh,
I'm sorry.
C-E-T-O-P-F-E-D.
Okay, and backwards?
Okay, D-E-F-P-O-T-E-C.
Very good, perfect, wonderful. Now, I'm going to inspect the internal cavity of your eyes, okay?
Okay.
And, all right, can you remove your glasses for me, please? And open wide. I'm going to get closer to you, okay?
Okay.
I could see the internal structures of your eyes, and I don't see any enlarged blood vessels. Let me go to the right side as well. Everything looks very normal. No enlarged blood vessels as well. Now, I'm going to go ahead and wear your glasses. I'm going to go ahead and inspect your nose. Okay. Just inspecting the nose, it looks midline. Your septum is midline, and I don't see an abnormal lesion. So I'm going to go internally to visualize what I can see, okay? I could see your turbinate pink mucosa internally on the left side. Yeah, I don't see any excessive drainage. I don't see any mucous drainage internally as well. Okay, now I'm going to assess for the patency of your nose, okay? And close your eyes. I want to see whether your optic nerve 1 works pretty well, okay?
Okay.
All right. What do you smell?
Alcohol.
Very good. Now close one nostril and breathe through it deeply. Out. Very good. And the other nose. Out. Very good. Now, can you remove your glasses? I'm going to palpate for the temporal artery of your head and your lymph nodules. Do you have any pain?
No.
Okay. I cannot feel anything. And tympanic membrane. Go ahead and squeeze for me. Tighten your jaw again. All right. Okay. I'm going to go ahead and feel for your lymph nodes, okay? Do you have any pain here?
No.
This is your preauricular. And I'm going to assess your postauricular. The occipital, any pain? I don't feel anything. Your tonsils, I don't feel anything. Your submandibular, nothing. And submantle, nothing. Let me go down. This is going to be your pre-cervical. I don't feel any lymph node here. And your post-cervical. Everything looks even, no bulges, no lymph node. And I'm going to assess your supraclavicular. I do not feel any lymph node here. Now I'm going to go behind to test for your thyroid glands, okay?
Okay.
And I'm going to ask you to swallow when I touch you.
Okay.
All right. Chin up. Okay, go ahead and stick a big swallow. Chin down. Another one. Good. I could not feel any bulges. And everything looks normal. All right. Let me go ahead and inspect. Please go ahead and close your eyes. I'm going to test for sensation to your facial nerves, okay? Which is your facial nerve. I'm inspecting your cranial nerve. I've already done 1, 2. I'm doing 3, 4, and 6 at this point. Okay. Now go ahead and close your eyes. I'm going to point the center part of your face. Let me know if you do feel anything and where you feel it.
Okay.
All right?
My forehead on the left.
Very good.
My cheek on the left. My chin on the left.
Very good.
My forehead on the right. My cheek on the right.
Very good.
And my chin on the right.
Very good. Did good with that. Now I'm going to also check for, can you remove your glasses? I'm going to check for conjugal gaze accommodation as well. And I'm going to do peripheral checks. I'm going to stand behind you. You let me know when you see my fingers, okay?
Okay. I see them.
Okay.
I see them.
Very good. Looking at me.
Okay.
Do you see anything? Again.
Yes.
Again.
Yes.
Very good. Now, you're going to follow my finger, okay?
Okay.
And I'm going to get close for accommodation.
Okay.
Looking straight ahead behind my shoulders. Okay, ready? And then pinpoint my finger, all right? Go ahead. Okay, look at my finger. All right. Then follow my finger, okay?
Okay.
Very good. Very good. Perfect. Everything looks symmetrical and normal without any problems. I'm now going to go ahead and test for your hearing test, all right? Now, I'm going to hit this. I'm going to put it on your forehead, and you let me know when you hear and when you stop hearing. This is going to be, this is the Weber test. Do you hear anything? Let me know when you stop hearing it.
Okay.
Very good. And I'm going to do the conjugal bone conduction. You hear it? Let me know when you stop hearing.
Okay.
Now, do you hear it?
Yeah.
Okay. So that's 32. Are you still hearing it? Okay, very good.
Okay.
which is perfect. Okay, so your air conduction is longer than your bone conduction. Let me do the similar thing to the other side, to the right side. Do you hear it?
Mm-hmm.
Do you hear anything?
Mm-hmm. Okay, I'm here.
Very good. So everything looks normal. Your air conduction is longer than your bone conduction. And let me go ahead and inspect your mouth.
Okay.
Okay. Looking at your mouth, they look symmetrical. Your lips looks normal, and your skin toggle looks hydrated, nice and intact, and your lips are even and symmetrical. Can you go ahead and open for me, please? Okay, I'm looking at the complete internal mouth. Your teeth looks good. Dentition is intact. You don't have any obvious loss of tooth. Your palate looks normal. Now I'm going to press down and inspect your inspect your internal lips. Now I can see your uvula, your palate is nice and even. The uvula is midline central. Go ahead and say ah. Very good. You do have a good gag reflex, and I don't see any enlarged, any drainage or abnormality in your mouth. Everything looks nice and intact. Do you have any pain?
No.
Okay, go ahead and stick your tongue out for me. To the left. Okay, right, up, down. Now, can you hit the cheek of your internal part of your cheek with your tongue, with your mouth closed? Great. On the other side. Very good. Everything looks symmetrical and intact. All right. And now let me go ahead and make sure that your neck can flex your range of motion. Okay. Now I want you to turn to your left completely. All right. Flex it to the left and then flex to your right. Good. Very good. And then up. Then hyperflex it as far as possible. Very good. And then forward, down. And then do a range of motion up through a circumference. Perfect. So everything looks great. Awesome. Good, good. Thank you for letting me do this. Now I'm going to go ahead and assess your cranial nerve 5, 7, and 8. Okay? And what I need you to do is can you remove your glasses for a few minutes, please? Thank you. I'm going to hold down. I'm going to inspect your skin again. Make sure it's nice and firm. There's no nevi in your face, and skin is nice and warm. I'm going to go ahead and hold onto your forehead and assess your cranial nerve 5. Go ahead and squeeze the temporal artery. Okay. Now clench your jaw. Again. All right. Okay. While you have your eyes closed, I'm going to assess for some sensation. Okay. You tell me where you feel it. Okay. Where do you feel it at?
On my forehead on the left.
Very good.
My cheek on the left. My chin.
Very good. Do you feel anything?
Right forehead. Cheek on the right. I mean the chin. Sorry.
Very good.
Chin on the right.
Very good. Awesome. Now you can open up your eyes. I'm going to ask you to try and blow some air. Make frown on your face. Smile. Go ahead and smile so I can check for symmetry. Okay, everything looks symmetrical. No abnormalities. Can you frown and squeeze your face? Your eyes are symmetrical. Your chin is symmetrical. Very good. Now can you blow air from your mouth? Puff your lips. Okay, purse your lips and squeeze your lips out. Okay, everything looks symmetrical. Great. I'm now going to do your cranial nerve 8, your hearing test. Okay. Now, I'll need you to let me know when you stop hearing the sound of this. Okay. Can you hear it?
Mm-hmm.
Very good. Now I'm going to test your bone conduction and air conduction. Okay. Let me know when you don't hear it anymore.
Okay. Okay, I don't hear it. Yes, I hear it.
Very good. Let me know when you don't hear it anymore.
Okay, I don't hear it.
Very good. So that's 30 to 65. I'm gonna cross check that on the right side as well. So AC is greater than BC. Can you hear it?
Yes.
Let me know when you don't hear it anymore.
Okay.
Do you-
Yes, I hear it.
Okay, let me know when you don't hear it anymore.
Okay.
Very good. So that's like 25 to 50. Awesome. So AC is definitely, that's normal. Your air conduction is greater than your bone conduction. Okay. Now,
Badika, does it?
excuse me, do you have any difficulty breathing?
No.
Okay. I'm going to go ahead now and assess your cranial nerve 11. I'm going to put a resistance on your shoulder and try and scrub your shoulder up against my resistance, okay? You ready? All right. Go ahead and show your shoulder. Again. Very good. Okay. This is symmetrical strength on both sides, the left and the right. Now, I'm going to go ahead and assess your posterior chest for your thoracic cavity, breathing, and tactile femoris. All right. I'm going to go ahead and inspect your back. Okay. Go ahead and cover your front. Okay. Now, can you breathe normally with your heads up, your shoulders straight? Okay. I'm going to inspect your back to make sure that you're breathing symmetrically. Your lung regions are symmetrical. Take a deep breath, please. Good. And your skin looks nice and intact, nice and warm, and identical to all the parts of your body that I have already inspected. I do not see any nevi. Skin toggle is nice and good and returning pretty well, showing that you're hydrated. Now, I'm going to go ahead and palpate. I need you to repeat the number 99, okay? Go ahead and say 99.
99. 99. 99.
Now, can you please say the letter E?
Okay. E. E. E.
Now, can you please whisper the number 1, 2, 3? Very good. I could not hear any extra loud sounds, and I couldn't even hear your whisper, which tells me your lungs are intact and good at this time. Now, I'm going to go ahead and palpate to assess the expansion of your lungs, okay? Now, I need you to take a deep breath. I'm going to squeeze it back and then take a very deep breath, hold it, and then breathe out, okay? And out. Out. Very good. Again. And out. Very good. Your lungs do expand symmetrically without any abnormalities, and I did not hear any cryptosis while doing this expansion. Now, let me go ahead and auscultate. Before I do that, let me percuss to hear for abnormal lung sounds. Okay? Now, take a deep breath while I do this. Again. I'm going to go assess the ventral side, right? Deep breath, hold it. Again. Very good. Now I'm going to go listen to your lung fills to make sure there's no abnormal adventitious sounds in your lungs. Okay, I'm going to start up here. Take a deep breath and out. Very good. Very good. Very good. Very good. Very good. Very good. Deep breath. Deep breath. And out. Again. Wonderful. I did not hear any adventitious breath sounds at the posterior side of your chest, and the chest wall is symmetrical without any abnormalities or lesion or drainage noted. Let me go ahead and assess the anterior part of your chest. Okay. Now I'm gonna have it. Okay. Now take a deep breath. I'm just gonna inspect for symmetry. Deep breath. Very good. And your skin looks the same color, just one nevi here, but it does not look abnormal. Skin toggle is nice and hydrated. You don't look dehydrated, and you're nice and warm. And I do not see any lesions or abnormalities in your chest, anterior chest wall. Okay, I'm gonna go ahead and repeat the same test I did at the back. I'm gonna test for the traumatus. Say 99.
99.
Again.
99. 99.
Okay, very good. Now I'm going to go ahead and just auscultate to make sure there's no abnormalities. Okay, I do not see any hips or lips. And I'm going to go ahead and assess for any adventitious breath sounds as well, starting from the upper subclavian clavicle area. Take a deep breath. Out. Again. Good. Deep breath. Okay, just so. Deep breath here. Now I'm going to lift this up, okay? Okay, deep breath. Very good, thank you. Again, I'm going to lift up. Take a deep breath. Very good. All right, I'm going to go ahead and also assess your heart for any abnormalities as well. Do you have any chest pain?
No.
Difficulty breathing or sleeping at night? Do you have to use extra pillows? All right. Okay. I'm gonna go ahead and inspect your chest wall. Still looks nice and intact. I'm gonna auscultate the 5 different regions of your heart, and starting from your aortic valve to the second intercostal space on your right. Okay. And that is your pulmonic valve. The rhythm is nice, strong, bound. The Eps point, midway through. Take a deep breath. Lean forward for me. Okay, then tricuspid valve, and then the meter valve. Okay, now I'm gonna need you to lie down for me, please.
Lie back.
Yeah, lie back, please. I'm gonna assess for the jugular vein distension again. Can you tilt to the left just to make, do you have any pain?
No.
I don't see any jugular vein distension. I do not see, I could feel the carotid pulse. I'm gonna assess for roots again. Okay. Okay, and I'm also gonna use the bell to assess the aortic valves as well as the 5 other valves of her chest wall. You can lift your head straight up now. The pulmonic, the Ebbs point, the tricuspid, and the medial. Do you have any pain?
No.
Okay. Now I'm also going to ask that you tilt to the left so I can assess your PMI, the point of maximal impulse. Turn, tilt all the way to your left side. Turn and tilt. There you go. Slightly to the left. All right. Okay. And I'm going to assess for the PMI, point of maximal impulse, using the bell.
Okay.
Okay. You can are you comfortable?
Mm-hmm.
Okay. And I'm going to listen to the rhythm of your pulse. Okay. You could lay back down.
Okay, lay back, turn over.
Yeah, turn over.
Okay.
It's okay. And I'm going to try and take a full aortic valve impulse rate, okay?
Mm-hmm.
You might need to lift your head up a little bit higher, okay?
Okay.
You tilt forward. There you go. It's better. Okay. Oh, sorry. Okay, that was 68 pulse, and the reading was regular and symmetrical throughout my assessment, okay? Do you have any pain? How are you feeling?
I'm feeling fine.
All right. Now I'm going to go ahead and check for your chest expansion, your breathing, the lungs, and the thoracic cavity. I'll first start by inspecting your chest anterior side region. Can you please take a deep breath for me? Out. Good. I'm looking at your skin for the color. Looks symmetrical and generalized with the other rest of your skin above. And you do have some, just 1 or 2 nevi I see here, but it does not look abnormal. And the temperature is still nice and warm. The skin turgor is good, returning well. And I'm also gonna go ahead and listen to your lung sounds and your lung field, okay? And before I do that, I'm gonna go ahead and palpate you, touch your skin, and I'll need you to repeat the number 99. I'm gonna test for tactile firmness, okay? All right, and this is your clavicle line, midway through. Put the palm of my hand on your chest, okay? Go ahead and say 99.
99. 99. 99.
Good. Everything sounds symmetrical. I didn't hear any abnormal sounds. Okay. And I'm going to go ahead and now auscultate for any abnormal breath sounds. I'll start from your clavicle line. Take a deep breath. Second intercostal space. Okay, deep breath. Out. Deep breath. And out. And out. I'm gonna lift this up, okay?
Mm-hmm.
Take a deep breath. Out. And then over here. Take a deep breath. Okay. I'm also gonna take a deep breath. Again. Everything sounds normal. I did not hear any crackles, rhonchi. There was no adventitious sounds. Do you have any difficulty with breathing? Hi, I'm now going to assess your abdomen for any abnormality. I'll first start by inspecting your skin for color, which is similar to the rest of your skin. It looks good. No nevi, no lesions, no drainage, no. The temperature is nice and warm, which is similar to the rest of your skin. I'm also going to assess for the symmetry and contours of your abdomen, and they look symmetrical without any abnormal gouges or bulges. Now I'm going to go ahead and auscultate your bruits for any abnormal sounds. Okay, I'm going to do the aorta, then the renal, and I'm going to do the iliac and the femoral. Then next, now I'm going to also auscultate the 4 quadrants of your abdomen, okay? Starting from lower part. Very good. I do hear abdominal sounds on all the 4 quadrants, which is good and normal. Next, I'm also going to go ahead and percurse your abdomen, okay? For any tenderness and dullness. And also, I'm now going to go ahead and palpate it for any tenderness and masses. And I'm going to identify your spleen and your liver. Your liver is on the upper right side, pretty parallel to your lower than your last rib cage, okay? And I'm going to palpate it for any tenderness, okay? Do you have any pain?
No.
Very good. And then that's your spleen. Any pain?
No.
I do not feel any tenderness. I do not feel any tenderness, which is good. Very good. Now I'm going to have you sit up. I've already identified the spleen. The spleen is to your left and the liver is to your right. Do you have any history of hepatic dysfunction, abnormalities, or gallbladder diseases? Okay, good. Everything looks great. Now I'm going to go ahead and assess your CVA, the gastrovertebral angle. Can you please sit up for me, please? Are you feeling okay?
Yes.
All right. And looking at the cervical intercostal space here, I'm going to give a quick stripe. Okay? Ready? Do you feel anything? Was it hard, sharp, tender?
No.
Okay. So good. So everything looks normal. Now I'm going to go ahead and assess your whisper test for this cranial nerve 7, okay, 8 as well, apparently. And I'm going to whisper from the back. You tell me what I'm saying, okay?
Apple. Banana.
Good. Your cranial nerve 8 is all intact. Now I'm going to do some joint assessment and inspection. Now I've already assessed your shoulders for symmetry. There's no deformity or bulginess. Can you flex, hyperextend your arms, please? Did you caught? I'm sorry. Now that you're dressed, I'm going to go ahead and assess your whisper test again for cranial nerve 8. Okay? And you just repeat whatever you hear. You ready?
Apple. Banana.
Very good. Your cranial nerve 8 is completely intact. Now I'm going to go ahead and do all your lower extremities and upper extremities for your joints. Assess it for any crepitus, any abnormality, dysfunction, pain. Do you have any pains in your joints?
No.
All right. Now can you go ahead and flex your shoulders? Okay. Abduction, and abduction. Rotated. Okay. And then hyperflex it to the back. And how far the back can you go? Good. What looks symmetric. Wonderful. Now, your hands down. I'm going to assess your elbow.
Okay.
Now, can you flex it forward and backwards and rotate it? And then hyperextend it all as far back as possible. Hyperflexion. Very good. Now, can you do the same thing for the left arm? In, out, and then rotate it and hyperflex it. Very good. They're both symmetrical. Now I'm going to go to your wrist. Okay. Do you have any problems with your wrist?
No.
Okay. Now I need to flex your hand. Now open it up wide and firm. Very good. Any pain?
No.
Now hyper extended. Now together, abducted. Open it all up. Okay, I'm going to assess the strength. Give me a firm grip.
Okay.
Okay, good. So it's 5 over 5. Can you push my hands? I'm going to attempt to push your hands down and hold it, okay? Very good. And I'm going to do the same resistance up. Very good. It's 5 and 5. Let me assess your radial pulse to make sure it's good. And then compare that to this. The rhythms are the same and symmetrical. Wonderful. Now I'm going to do another quick test, okay? Using your nose and your finger. I'm going to move my hands around and you point to my hand and to your nose. You ready? All right. Go ahead and touch my palm and your nose at the same time simultaneously.
Okay.
All right. Go ahead. No, using one finger like that.
Oh, okay.
Yeah. Okay. Then go. Keep going. Again. Again. Very good. Very good. Now we're going to do the finger to finger assessment. Now can you each finger to your thumb and the other one. That looks good. I don't hear any crepitus, no cracking, no bulging. Do you have any pain?
No.
Very good. Now I'm going to go ahead and assess the deep tendon reflexes of the upper extremity, okay? We're going to do the brachioradialis to your right arm. Very good. Then do your bicep. Very good. Let's do your tricep. Very good. And I'm going to do the similar thing over here. Brachioradialis. Very good. Your bicep. Very good. And then your tricep. Very good. And I'm going to go ahead and do your patelis.
Okay.
Palpate to your knee for any abnormalities. Okay. Good. Very good. And then I'm also going to do Achilles. Achilles. Very good. They're both symmetrical. Very good. And then I'm going to do your Babinski.
Okay.
All right. Very good. You wrapped up pretty well.
Yeah.
Very good. They were symmetrical and intact. Now, can you lay back down? I'm going to assess your hip.
Okay.
No, flat down, supine position.
Oh, okay.
I'm sorry. Oh, you could do that too. Are you comfortable?
Yeah.
Okay. Get all that out. I'm sorry. Let me stretch this out. Okay, now can you separate your legs? Now I need you to hyperextend each leg one at a time. Okay, and the other leg. Very good. Can you abduct it away, separate it, and then together. Adduction. Now can you rotate each leg? Very good. Very good. Now can you bend your knee all the way to your hip? Do you have any pain? Very good. Now the other knee as well. Very good. Now, do you have any pain as you're doing that? Everything looks symmetrical. Now can you turn to your side? So we check for any bulges while you're accessing your hip. Now can you separate, bend your hip. I'm trying to see if you have any pain at an angle. So bend your hip to your knee to your hip. There you go. Any pain?
No.
And then can you separate it? Adduct it. Very good. And then circular motion. Wonderful. Any pain?
No.
Looks symmetrical. Now can you try the other leg, please? Turn over towards my side. You need any help? Nope. Very good. Now extend your legs. Very good. Flex it. Wonderful. Rotate it. Very good. Awesome. That sounds great. Looks good. Now I did not hear any crepitals. No cracks. Do you have any pain?
No.
They look symmetrical. Now you could go ahead and sit up. Now get on your toe. Okay. Stand up on your feet. And we're gonna do the run back test. I'm gonna have you close your eyes and your hands forward. Okay.
Okay.
Now close your eyes with your hands forward. Close your eyes for a minute. Okay. You did good. It was normal. He did not tilt. That's fine. You can open up now. Now I need you to walk heel toe forward to the door and back. Ready? Heel toe. And go ahead and turn. Again. Very good. Now you could go back to your chair. Did very good. Everything looks normal. Now I'm going to check vibration on your lower leg, okay? And before I do that, I'm going to close your eyes and put some items in your hand. That's for Stereognosis and also the graffitis here.
Okay.
Okay. Now go ahead and close your eyes. I'm going to put some items in your now open up. Okay. What is this?
Tissue.
Very good. Now I'm going to draw something on your palm. And you're going to tell me what it is, okay?
At 8.
My
Oh,
hands.
sorry.
Let me do this again.
At E.
Very good. Or
At E.
very good. You got that right. And now I'm going to assess for vibrations, okay? And while you have your eyes closed. And let me know if you feel anything, okay? And where you feel it.
Left arm. Right arm.
Very good.
Wrist. Left wrist.
How many fingers?
2.
Very good.
2. 1.
Very good. Now I'm going to do the same thing downwards, okay? Let me know if you feel anything. Separate your legs, please. All right. Your eyes closed. All right. You feel
Left leg.
very good.
Right leg. Right foot. Left foot.
Awesome. And the final test I'm going to do is the knee vibration to your toe, okay? And you let me know if you feel it.
Yes.
Good.
Yes.
Where do you feel it?
My right toe.
Very
right big
good.
toe.
So that completes my assessment. Thank you so much for working with me. And everything looks normal. Do you have any questions?
No. I don't.
Thank you so much for the time.
Thank you.
Now I'm going to go ahead and assess your pulses. I've already done your radial pulse, and they were symmetrical, and the similar reading. Inspecting your hands for any abnormalities, deformities, lesion. Inspecting your knee for any abnormalities or lesion. Do you have any knee pain?
No.
Okay, I'm going to palpate it for any bulges or crepitus. Can you move it up? Okay. And then this, I do not hear any crepitus. And I'm going to also palpate for your pulses. Those are pulses here, and they're symmetrical, bounding, and regular rhythm. Let's go ahead and your posterior tibial pulse. They're similar reading and similar rate. Now, can you go ahead and hyperflex your plantar toes, spread out, and let me check also your capillary fill on your toes.
Okay.
Yeah, good return. And your fingers again, please. Good. Less than 3 seconds. Very good. Now I'm going to put pressure on your toes and you push it back up. Okay. Now press down. Good strength. 5 over 5. And your ankles, inspecting it looks intact. No lesions. Skin color the same. Symmetrical. Now I'm going to push back and you resist me. Okay. You ready? Very good. And backwards. Push it away. Very good. Good strength. 5 over 5. Now, can you please stand up and I'm going to check your back. Make sure you don't have any scoliosis. Okay. And I'm going to inspect your back. And you're going to bend over for me to make sure you have the natural curvature of your skin. Okay, this is nice and symmetrical. S. Very good. No indication for scoliosis. Thank you very much. And then I'm going to also have you to just walk and let me assess your gait to the door and back. Do you have any pain while you're walking?
No.
Everything looks symmetrical. And then can you hop on one toe?
Okay.
Very good. Any pain?
No.
Very good. Wonderful. Everything looks normal to me. There was no abnormality, it was symmetrical, and I didn't see any deformities. I didn't hear any crepitus. So everything looks good.
Okay.